Finally, and this is, I suppose, the most obvious point, the relationship of a university like Duke to the Research Triangle Park is essential in providing links that help us fulfill our mission of translating academic research into the world of real-world practice and real-world service. I don't know if you know the story of Duke. Duke was a small college called Trinity College until the industrialist James B. Duke gave a fortune to turn it into a comprehensive research university in the late 1920s. He had in mind to create not just a place of international intellectual eminence, but specifically a place that would link intellectual labor to practical benefit in the world. He spoke of wanting to found a place that would be a place of sane and practical rather than ideal and dogmatic education. I love being associated with a sane institution. In any case, moving forward from that founding, we have always had the idea that we want to think of the work of universities as forming an arc that extends from inquiry through discovery, through translation, to carrying the benefits of intellectual labor out into the world of real-world practice and real-world service. But as you well know, or unless in your country it's very different from in this country, there are many reasons why that arc tends to be broken or discontinuous in American universities. It's the nature of American university culture that a lot of researchers don't spend a lot of time thinking how to turn their ideas into practice or carry them out into worldly applications. Publishing a work, having it be recognized by one's colleagues seems the sufficient reward or the sufficient completion of the labor. And even to the extent that we want to promote the practical development of innovations that are bred in our walls, universities themselves aren't always well equipped to carry research discoveries and experimental hypotheses out to full development with all that requires in terms of funding mechanisms, managerial know-how, specialized technology, expertise in navigating regulatory environments, and so on. Like most research universities, Duke does some of the work of tech transfer in-house, but it is an essential advantage for both the university and its investigators to have access right down the street to a research and development apparatus that is adjacent to, that is complementary with, but that is not identical with the apparatus of academic research to help faculty members carry their inventions into practice and commercial development. I'll give you two examples and then I'm done. There is a product called Fusion. This was a groundbreaking new drug that treats therapy-resistant AIDS. It had its origins in the lab at Duke of Professor Danny Bolognese, former director of the Duke Center of AIDS Research, and Tom Matthews, associate professor of experimental surgery. In the early 90s, they developed technology that prevents infection by blocking the fusion of the virus with white blood cells. With backing from investors and help from RTP, the startup company Trimerus was formed. Trimerus, along with Roche Pharmaceuticals, has now markets and distributes Fusion to hundreds of thousands of AIDS patients around the world. But you understand my point. This wouldn't have happened without the doctor's discovery, but it wouldn't have happened if there were not a means to carry that discovery out. You know that the word translation comes from the origin carry across. It's the carrying across function that has been so valuably performed by RTP. Or I might mention a drug called myozine. This cures a rare but extremely grave malady called Pompey's disease, a genetic disease that prevents the body from processing the enzymes needed to turn sugar into energy. Children who have it never recover and progressively lose the ability to lift their head, to sit up straight, indeed to move. A Duke researcher named Y.T. Chen, chief of medical genetics at Duke, found a possible treatment. And because the disease is predictably fatal in infants, there was an increased sense of urgency to bring clinical trials and produce the medicine. Duke, to accomplish this, only needed to look 8 miles down the road. The RTP-based drug development company Synpac provided the funding and resources to fine-tune the research and to conduct the clinical trials, ultimately leading the FDA approval of myozine in 2006. I'll finish by saying I've been describing a lot of different kinds of benefits. They're different, but they're mutually supportive. In practice, they're somewhat hard to separate. In these days, the modern research university, academic institutions can do more good than ever for their surrounding societies. As I walk through my campus and I see the work people are doing on breast cancer, on genomic screening, on identifying ways to make roots grow to produce drought-resistant crops, handheld diagnostic devices that don't require electricity to diagnose malaria. This is the kind of work one's colleagues are doing in a great university. All that work is being done, also important, but we need a matrix of interaction in which many different kinds of institutions can work in unprogrammed but collaborative fashion if we're going to get that idea work carried out into the world of commercialization and then into the world of human benefit. Go back 50 years and you come to a time when the association of the universities of this area and the Research Triangle was really notional. They were patched together and made to seem to have something to do with each other. Over time, a deep and mutually beneficial relationship has evolved, but I do not doubt that in the next 50 years, this relation will be tighter and tighter and the forms of its benefit greater and greater. Thanks so much.